Hello, in this video we are going to talk about heel pain in children. Heel pain is a frequent complaint in active children and adolescents. Unlike adults where heel pain is often related to plantar fasciitis, heel pain in the pediatric population is most commonly linked to growth-related conditions. While often not serious, it can cause significant discomfort and limit participation in sports and play. Understanding the causes, symptoms, and treatment option is crucial to parents, coaches, and healthcare providers. The heel bone, or calcaneus, is a critical growth area at the back called the calcaneal apophysis. This is a cartilage plate where bone growth occurs. In children, this area is weaker than the surrounding tendons and is a common site for inflammation and pain, especially with high levels of physical activity. The overwhelming majority of heel pain in children aged 8 to 14 is due to a condition called calcaneal apophysitis, commonly known as Sever's disease. It's important to note that it is not a disease but an overuse injury. What it is: inflammation of the growth plate in the heel due to repetitive stress and traction from Achilles tendon. Who gets it? Active children, typically between the ages of 8 and 14 during periods of rapid growth. It's more common in boys than girls. Why it happens? A perfect storm of factors contributes. Those are all growth spurt, high impact activity, footwear, and foot mechanics. Let's talk about growth spurt. The bones often grow faster than muscles and tendons. This causes the Achilles tendon to become tight, pulling with more force on the heel's growth plate. Second, high impact activity. Sports involving running and jumping like soccer, basketball, gymnastics, track place repeated stress on the heel. Third, footwear. Poorly supportive or worn out shoes fail to absorb shock effectively. Fourth, foot mechanics. Flat feet, otherwise called pes planus, or high arches can alter gait and increase strain on the heel. Other potential causes and diagnosis. While severe disease is the most common cause, other conditions can also lead to heel pain in children and must be considered. Number one, Achilles tendinitis. Inflammation of the Achilles tendon itself rather than the growth plate. The pain is located slightly higher above the heel bone. Second, plantar fasciitis. Less common in children than adults. This inflammation of the thick band of the tissue running along the bottom of the foot. Pain is typically felt on the sole of the heel and is worst with the first steps in the morning. Third, stress fractures. Small crack in the heel bone caused by overuse and repetitive impact. The pain is often more localized and sharp and persists even at rest. Fourth, bursitis. Inflammation of the bursa, a fluid-filled sac at the back of the heel, often caused by stiff shoes rubbing against the area. Fifth, tarsal coalition, a rare congenital condition where two or more bones in the back of the foot are fused together, leading to rigid, flat feet and pain, often in adolescents. Sixth, infection or tumor. These are very rare but serious causes. The red flag symptoms include constant pain, even at night, fever, swelling, redness, warmth, and unexplained weight loss. How to diagnose? The diagnosis is typically made through a combination of medical history, physical examination, and imaging. In medical history, the doctor will ask about child's activity level, the answer, and the nature of the pain and any recent growth spurts. On physical examination, the doctor will press on the heel to locate the precise area of the pain. The skews test on the sides of the heel is a classic for severe disease. They will also assess foot structure, flexibility, and gait. X-ray is often not necessary to diagnose severe disease as the growth plate appears normal. However, they may be ordered to rule out other conditions like stress fractures, bone cysts, or tumors if the presentation is atypical or the pain is severe. How to treat? The cornerstone of managing most pediatric heel pain, especially severe disease, is a conservative care. The primary goals are to reduce pain and inflammation and to modify activities to allow for healing. Number one, rest and activity modification. Relative rest. The child does not need complete bed rest but should reduce or eliminate activities that cause pain. This is the single most important step. Second, cross training. Substitute high impact sports with low impact activities like swimming or cycling to maintain fitness without stressing the heel. Second, pain and inflammation control. Ice therapy. Apply ice packs to the painful heel for 15 to 20 minutes after activity and whenever pain flares up. Never apply ice directly to the skin. Over-the-counter medications. Non-steroidal anti-inflammatory drugs like ibuprofen can help manage pain and inflammation, but should be used under the doctor's guidance. Third, addressing biomechanical factors. The first, supportive footwear. Ensure the child wears well-cushioned, supportive shoes with a firm heel counter. Avoid worn-out shoes, cleats, and flat-soled shoes like Vans or Converse during daily wear. Heel lifts and cushions. Placing non-prescription heel lifts or pads inside both shoes can help raise the heel or reducing tension from the Achilles tendon on the growth plate. Orthotics. For children with significant flat feet or high arches, custom or over-the-counter arch supports like orthotics can improve foot alignment and distribute pressure more evenly. Stretching and physical therapy. Stretching exercises. Gently stretching the calf muscles and the Achilles tendon is crucial. Key exercises include calf stretches against a wall and towel stretches. A physical therapist can teach a proper stretching and strengthening regimen and may use modalities like ultrasound to aid healing. Prognosis, prevention, and when to see a doctor. The outlook for children with severe disease and other common causes of heel pain is excellent. It's a self-limiting condition, meaning it will resolve on its own once the growth plate closes, typically by the age 14 to 15 in girls and 15 to 16 in boys. With proper management, symptoms can usually be controlled effectively, allowing child to remain active. Recovery from an acute episode can take a few weeks to few months. Prevention strategies. Invest in high quality sport appropriate shoes and replace them regularly. Pre-activity stretching. Incorporate a routine of calf and Achilles stretches before and after sports. Avoid overscheduling and ensure there are rest days between intense activities. Maintaining a healthy weight reduces overall stress on the feet and lower limbs. Finally, when to seek medical attention. Consult a pediatrician, pediatric orthopedist, or pediatrist if your child experiences persistent pain that does not improve with a few weeks of rest and home care. pain that is severe enough to cause a limp or prevent walking, night pain or pain at rest, signs of infection such as redness, swelling, warmth, or fever, numbness, tingling, or weakness in the foot. Conclusion: heel pain in children is common and usually temporary part of growing up for many active kids. By understanding that it's most often a mechanical issue related to growth and activity, parents and caregivers can effectively manage the condition through a combination of rest, proper footwear, and stretching. While frustrating, with patience and the right approach, most children can navigate this painful phase and return to pain-free activity. Thanks for watching. Please share this with others, and we will see you in the next video.